A 45-year-old man comes to the physician for a regular checkup. He has a 25-pack-year smoking history. His father recently passed away due to lung cancer, and he expresses that this has given him a wake-up call to quit smoking, but he isn't sure where to start. Which of the following would be the best next step in this patient's care? Choice A. Advise the patient of internet resources and support groups he can try. Choice B. Provide and go through a pamphlet on smoking cessation with the patient. Choice C. Prescribe a nicotine patch for the patient. Choice D. Provide a patient with a mood disorder questionnaire. Choice E. Ask the patient why he wishes to quit smoking. I'll wait 5 seconds and answer the question. So this patient is in the preparation stage, right? He's already made the decision to quit smoking and he's looking for a plan of action. That's not the focus of this question, but I just decided to point that out because that's something that comes up. Now, usually in cases like this, you of course ask open questions as the rule is, which is, just ask, oh, why do you want to do this? Or can you tell me more? Or tell me how you feel. In this case, however, you already know why he wants to quit smoking. He straight up told you why he wants to quit smoking. So the next best thing for you to do is to help guide him on making his plan of action. So choice B, provide and go through a pamphlet on smoking cessation with the patient, is the correct answer. And even though this might seem like common sense to a lot of you, you need to actively go through things with the patient in order to get them to have better compliance or better adherence to whatever they decide to do. And that's why choice A is wrong, because choice A is like you offloading it to internet resources and support groups. That doesn't make sense. On USMLE, most answer choices that allow you to offload the decision making or responsibility to some other source is the wrong answer. Now, there are some very, very rare questions where referred to another provider would actually be a correct answer. Usually it would be something like a conflict of interest on your part or something. But let's not stray too far from the topic. Just as a general rule, any answer choice that says, oh, tell someone else to do it, or get another provider, refer a patient, or tell them to go to a support group, these are usually wrong answer choices. Choice C, prescribe a nicotine patch for the patient. You might do this later, but it's premature to be doing this. Especially when you get to step 2, they really love giving you answers where it's like you prescribe a medication, you need to know when that's overkill. Choice D, provide the patient with a mood disorder questionnaire. Now, of course, this patient lost his father recently, but the question makes no mention of, just Siggy Cap symptoms. He doesn't have anhedonia, he doesn't have changes in his sleep, he doesn't have changes in appetite or loss of interest or anything like that. So grief isn't really a factor in this question at all, so you shouldn't have picked this. Choice E, ask the patient why he wishes to quit smoking. Like I said, in this particular question, I already told you why he wants to quit smoking. So if you picked this, it's because you weren't paying attention. Or in the case of the question, it's more like you didn't read the question properly, which, of course, you want to get in the habit of doing that very carefully, because especially in step 2, they start giving you some very annoying questions where they're throwing one line in the question that helps you rule out certain answer choices. Okay, so you want to be careful of that. Read questions carefully. So bring it back. Like I said, you just want to actively engage with the patient, assuming you've already satisfied the most basic thing in ethics questions, which is obviously be polite and have a patient-centered approach. Try to be empathetic, talk to them about how they feel, what they want, what their motivation is. But if you already know that, then actively engage with the patient. Hope you found this video helpful. I'll see you in the next one.